I'm gonna get that
Hi,
slideshow
everybody.
up for you.
Thank you. Hi, everybody. It's nice to be here with you all this evening to talk about Beyond the Physical. Okay. I wasn't seeing this slideshow. Is anyone? Okay, now it's going. There we are. Perfect. If you can forward the slide, please. All right. So I want to start by talking about our agenda. What exactly are we going to talk about today? We're going to talk about preventative health, what it is. Sometimes you'll hear the term preventative health used as well as you might hear preventative care. It really is the same thing. We're going to talk about why preventative health is important. We're going to talk about the cost of preventative health, in addition to an annual exam, and also going beyond the physical exam, what other things should be being done. Also, I thought it would be a great time to discuss navigating medical coverage after the age of 26. And most certainly I'll provide the resources that I discussed tonight. And then at the end, most certainly we will have time to talk about any presentation related questions. Next slide. Okay, so what is preventative health? Preventative health, it refers to medical services and lifestyle practices aimed at preventing illnesses, detecting health issues early, and promoting long-term wellness before symptoms appear. This includes, but is not limited to, your annual wellness visit with regular checkups to monitor your overall health, routine screenings, tests for conditions like high blood pressure, diabetes, cholesterol, and various cancers. Examples of some of those tests can be mammograms, colonoscopy, and there's a whole long list. I don't want to bore you with going through them all. Most certainly vaccinations are important. Immunizations to prevent diseases like the flu, COVID-19, measles, and HPV, just to name a few. One thing that is typically, unfortunately, forgotten about by some providers is doing those mental health screenings for conditions like depression and anxiety. Just because someone doesn't currently have a diagnosis of depression or anxiety, it doesn't mean that the doctor should not be screening you for that at each visit. Most certainly, if it's identified that you're struggling in any way, it's much easier to treat conditions like that if they're identified early. Also, what should be included is lifestyle counseling. So what do we mean by that? They should be providing you guidance on your diet, exercise, smoking cessation, and stress management, to just name a few. They should also make sure that you're up to date with your dental and eye exams to catch issues early and maintain oral or visual health. Unfortunately, individuals with intellectual and developmental disabilities, they do need the same preventative screenings as their peers, but also there's a whole list of other screenings and things that are tailored to the specific health risks associated with their disability. But we're going to talk more about that later on in the presentation. Next slide, please. Why is preventative health important? Preventative tests are routine screenings aimed at identifying potential health issues before symptoms appear. In contrast, diagnostic tests are ordered when you present to the doctors because you're presenting with some symptoms. Once the symptoms are present, unfortunately, this normally ends up resulting in diagnoses that are delayed, and it does take longer, again, to get the effective treatment as it would be if it's caught ahead of time. Next slide, please. Cost. As we know, our members are eligible for Medicaid, so cost is not always, usually an issue. But in addition to Medicaid and Medicare and commercial insurance, the good thing about preventative services is typically they are covered by all those entities, and there should not be an out-of-pocket expense for those preventative cares. But I would always encourage you to check with your insurance carrier to make sure that whatever you're having done is covered by them, so there's no surprises. Next slide, please. Okay, now this is when we get into the nitty-gritty of things. The annual physical and annual wellness visit. What should that look like? Whenever you're having your annual exam, your doctor or nurse practitioner or physician assistant, I want to include them too because they're just as important, they should be reviewing your medical history. They should be talking about any illnesses, surgeries, or hospitalizations that you've had since the last time you saw them. In addition to that, they should be reviewing what your current medications are and supplements. Typically, people see multiple providers, And so it's very important that your primary care physician is well aware of each and every medication that you're taking, in addition to any supplements that you may be taking over the counter that aren't being prescribed. In addition to the medications, they should be talking about any side effects, especially with psychotropic medications. And for those of you who are not familiar with what psychotropic medications are, those are drugs that affect your mind, emotions, and behavior, and they're primarily used to treat mental health disorders. They can cause a lot of side effects, and therefore those specifically, in addition to the routine ones, should be being monitored for those side effects. Also, they should be monitoring for polypharmacy risks and interactions. For those of you who are not familiar with the term polypharmacy, it's referred to when somebody takes 5 or more medications. It's not just your prescribed medications, but that also includes over-the-counter and complementary medicines. It may be herbs and things of that nature as well. So you can only imagine the majority of people do take 5 or more medications. The more medications you take, the higher risk there are for interactions amongst them, which then can result in some side effects. So they should definitely be reviewing that. Most certainly family medical history. It changes from time to time. From year to year, when you go see the doctor, maybe one of your family members was given a new cancer diagnosis or diabetes diagnosis. It's important that your provider knows that, because the more family members with those types of conditions, unfortunately, put you at higher risk for developing those conditions yourself. Also, lifestyle habits. They should be talking about your diet, exercise, are you smoking, and as well as your alcohol use. Just because somebody wasn't using anything before or wasn't smoking doesn't mean they aren't now. Somebody could have quit smoking last year, but went through a traumatizing event and started smoking again. So they should be asking that in each and every visit, including the physical exam at minimum, and not assuming that the status remains the same as the time before. Again, I know I already mentioned this, but they're talking about those mental health concerns such as anxiety and depression, and also reviewing your vaccination status. So that's just going over the medical history review. So we're just getting started here. They should also be doing your vital signs, which should include your blood pressure, your heart rate, your respiratory rate, and your temperature, in addition to your oxygen saturation. That's the pulse ox to put on the end of your fingertip, but not everybody needs to have that done at an annual physical. But if you have a diagnosis of asthma and or what's called chronic obstructive pulmonary disorder, or COPD, definitely those two at minimum, they should be monitoring you for that routinely. Also, they should be looking at your weight and height. They should be using that information to calculate what's referred to as your body mass index, or what you may hear more so called the BMI. The higher your BMI, unfortunately, that puts you at higher risk for conditions such as diabetes and cardiac conditions. So that's why they should be keeping a close eye on that. Then we get down to the physical exam. They should be using their stethoscope to listen to your heart, listen to your lungs. They should be palpating your abdomen when they push on your stomach, just to see if you have any discomfort when they touch specific areas. They should be checking your skin for rashes, moles, or abnormalities. I have to tell you, one of my pet peeves is we see with a lot of our members who are wheelchair dependent, and they're not even taken out of their wheelchair to have that physical exam done. They're never put on that table. And that presents with a lot of risks, and specifically when it comes down to skin. People that are in wheelchairs are at higher risk for skin breakdown because they have pressure, right? That you're sitting all day long. If there's somebody who can't adjust themselves in their wheelchair, or maybe doesn't have the wheelchair that's fit to them appropriately, they would most certainly be at risk for breakdowns. And it's not just a matter of having, a little rash or something like that. A skin breakdown can actually lead to infections. It can actually go into the bone. And not to scare anybody, but it can lead to what's called sepsis. That's a blood infection that goes through your body that can result in death if it's not identified and treated in a timely manner. Unfortunately, once someone does experience skin breakdown in a particular area, then even when it does resolve, it's not uncommon that it can happen again. So they have to continually monitor those areas. And to make matters even worse, if someone's diagnosed with sepsis in their life, then they are more apt in the future to end up with sepsis again. So that's why this is very crucial. In addition to that, they should be doing a lymph node check. They should be checking for reflexes and neurological testing, and looking at your ears, nose, and throat and inspecting that as well. Next part they should be doing is screening and lab tests. Depending on your age, gender, and risk factors, They should be doing blood tests like cholesterol, glucose, thyroid function. They should be doing a urinalysis. They should be doing some cancer screenings, like I mentioned, the mammogram, but also pap smears, colonoscopies, all those things. Making sure that somebody's up to date with all of these. And most certainly, I don't want to, negate the fact to say that all the things that I'm reviewing with you guys are things that should be done with a routine annual physical. However, there are exceptions to the rules. Most certainly, it may be a situation where your doctor doesn't feel like you need to have pap smears or colonoscopies, and you guys have had that discussion, or other tests or items that I'm mentioning. Most certainly, your doctor should know you best, and you should be following their advice on what should and should not be done for whatever reason. You should be having vision and hearing tests, bone density scans, as well as immunizations. And again, back to that mental health piece, right? Checking on that signs of depression and anxiety. They should be doing the full assessment, and they should be discussing the emotional well-being. And then, to be honest, they shouldn't just be worried about our members' emotional well-being, but how is their caregiver doing? We take on a lot of daily stresses ourselves, and if we're not in a good place, how can we care for our loved ones? So doctors should be taking that into consideration as well. Is the caregiver able to take care of that person? Are they starting to struggle? They should be having these conversations and identifying it earlier so they can help out where need be, and put in and assist you guys with some resources. I know our care managers do an excellent job of helping you guys out with that, but it's also important to know that your provider should be on board with all of this as well. They should also be alert to nonverbal cues and changes in behavior that may indicate distress. Unfortunately, our providers are not always well versed in working with our population, those with intellectual and developmental disabilities. I can truly say my nursing career, it was a very short part of our program, and physicians that's not required at any part of their schooling that they specifically work with our population to understand the differences. And how just because someone may not be able to speak and be verbal doesn't mean that they don't communicate their wants and needs, their likes, their dislikes, but not all providers are in tune with this. So they should be, and hopefully we're working towards that. And just a fun fact that I always entertains me, believe it or not, physicians aren't required to have the training working with individuals with intellectual or developmental disabilities. However, dentists are, it's now part of their program. So let's keep our fingers crossed we're moving in the right direction, and we'll see that in the future with our physicians as well. Counseling and preventative guidance. You should be, again, counseling on diet and exercise recommendations based on all of your conditions. It's not uncommon someone has multiple conditions, right? So in one breath, we're saying, eat less carbs because you're diabetic, but then we're telling somebody, well, you have high blood pressure, so decrease your salt intake too. Yes, that's true, but they might need a little bit of help in identifying those foods that fall within both of those categories. Smoking cessation or alcohol moderation should be discussed. Referrals to specialists if there's any concerns, as well as they should have discussions about any concerns or symptoms the person may be having. I always like to go to my appointments with a list, because it feels like you get there, you get in the room, your mind may wander a little bit, or the doctor's rushing you through and you just don't have the things addressed that you wanted to. So it's never a bad idea just to make a little list, bring it with you, and give it to the nurse, so the doctor's well prepared before they walk into the room. I should say provider, not doctor, that of the things that you plan to discuss at that visit. Other considerations and discussions. They should be considering the person's mobility. Are there changes in their ambulation since the last time they saw them? Have them get up. If they're ambulatory, watch them walk. See if there appears to be any issues. Any issues with sensory or behavioral challenges when, is that suddenly a problem? And specifically, if they're making recommendations and referrals for specific tests, they should be looking into that individual's unique preferences. If there's going to be behavioral challenges to get somebody through an MRI, the doctor needs to address that and be looking at different medications or other items to calm the person's fears instead of just treating them like everybody else. So I know that was a lot. So now I just want to take a breather, and I want to see with a show of hands how many people, when they see their provider, they're doing all those things. I know not mine, but this is what they should be doing. It's definitely to be expected. Kate, does your provider do all those things?
No, certainly
All
not.
right.
I love my
Yes.
provider too.
Yes. And the thing is it's just, and I'll get to some easy tools for you guys. So don't feel like you have to memorize all this, because that's what we're going to be getting to next. Because even myself, my provider doesn't do all these things, but I'm in tune with what's going on. And also with my daughter, Veronica, and the rest of my family. So I'm not as nervous about it, but some of our members aren't able to necessarily have that person to do that for them. So that's why this is definitely important information. All right, next slide, please. As I was mentioning, I did not expect anybody to have to memorize all of this information, but here's a really cool tool. It's called My Health Finder tool. So if you Google this, you can pull it up, as well as at the end, we will provide you a link to this information. All you need to do is answer 2 or 3 questions. You put in your age, you put in your sex. If you are a female, then we'll ask you if you're pregnant. If you selected the male, then the pregnant question would not come up. And then you click Get Results. So you'll see in this scenario, I put in a 25-year-old female. I did not put that she was pregnant. And then it's telling you exactly here, it's spelling it all out, everything that person should have done. They should, I'm not going to read through it all, but you'll see the screenings, the blood pressure screening, cervical cancer, so that pap smear, hep C screening, HIV testing, vaccinations. And that just talks about some of the conversations that they should be having. And a lot of this I just reviewed. But this is just a nice tool because you don't have to memorize what it is your doctor should or should not be doing based on that information. Next slide, please. And I just thought it would be a nice comparison to show you how it looks a little different for what a child would look like. So here I have an example of an 8-year-old male. And when you get results, it says schedule these screenings. And it does talk about it. He's only 8, but yes, we should be talking about anxiety. And then the well child visit will encompass all those other things, the blood pressure, the weight, and all of those types of things. But talking about skin cancer, that's something that based on that age is. So I do encourage everybody to, utilize this. What you can do is you can do this, get results, and you can print this screenshot. And then what you can do is bring that with you to your provider's office visit and kind of check those boxes, go down through there and make sure that you feel comfortable that your doctor has covered all those areas. Unfortunately, this does not, include the syndrome-specific testings and other things you should have necessarily done based on your disability, but at least it's a basic starting point of routine things that should be being done at that visit. Next slide, please. All right. So now we're going to talk about additional physician responsibilities, and for specific to people with intellectual or developmental disabilities. They should be doing syndrome-specific screenings. They should be avoiding diagnostic overshadowing, and they should be doing accommodations during exams and functional assessments. And I'm going to give you more additional information on all of this as we go forward. Next slide, please. All right. Unfortunately, there's too many syndromes to go over all of them. These are the more common syndromes that we see in the members that we serve here at LifePlan and ACA, but I will provide you a resource at the end if your specific situation is not covered. Most certainly there's a great resource called NORD, and we'll provide you the link to that as well, where you could put your information in there and it'll give you the similar information. But for people who have cerebral palsy, in addition to all the other things I just mentioned, they should be doing orthopedic monitoring. And what we mean by that is looking for any joint contractures, scoliosis, or hip dislocation. This can be common for those with cerebral palsy. They should be doing a bone density test, and especially if the person is non-ambulatory. And to be honest, if somebody is non-ambulatory and has any condition, they should be doing those bone density tests. This is not just specific to those with CP. They should be checking for spastic management, review of medications and therapies. Would this person be a candidate? Are they on baclofen? Would a baclofen pump be of more better interest? Because baclofen pumps administer a very minuscule amount of the medication versus an oral dose, which then ultimately results in less chance of side effects. So that might be a discussion somebody would want to have with their provider. For those with Down syndrome, thyroid functioning is important. They're at higher risk for having thyroid issues, so that should be being screened annually. And they have what's called I cannot pronounce this very well, guys, bear with me, anteaxial instability. And to break it down into easier language, what that is it's an excessive movement between the cervical discs in your spine. So those are neck discs between 1 and 2. This is a common thing for the people with Down syndrome to have. So how do you know if you have that problem? There's a cervical spine x-ray that they would do. They would do it if somebody's symptomatic, and symptoms like neck pain, stiffness, or restricted movement. If suddenly someone's, maybe they're not able to tell you that they're in pain, but you're seeing a lot of head tilting or reluctancy to move their head. They're kind of resisting a little bit. They might report fatigue with walking, or you may notice that they're fatiguing more. There might be some gait changes or clumsiness. Might be some weakness to their limbs or some numbness or tingling. Loss of motor skills. So suddenly you notice that this person who, was fairly good with carrying things is suddenly dropping objects. That could most certainly be a sign that there's an issue, as well as incontinence of their bowel or bladder. If they've never had that problem before and it's starting, it could be a problem with those discs. As well as in severe cases, somebody can actually start experiencing some breathing difficulties. So that would definitely be more of a medically emergent situation where they, if they're ruling everything else out, they might want to check on that as far as checking in on the neck. But in addition to that, if somebody who is not symptomatic but is about to participate in any sports that can lead to spinal cord compression, any type of trauma, then they should be doing that x-ray as well. So a lot of people enjoy horseback riding, and that's the first thing I think of is if somebody with Down syndrome wants to try horseback riding, this x-ray should be being done before that ever occurs to make sure that they don't have that issue. Hearing and vision can be a problem, and so that should be monitored regularly, and your physician should be telling you how often you should be doing that. Sleep apnea is not uncommon, and if symptoms are present, things such as loud snoring or gasping during sleep, pauses in breathing, morning headaches or dry mouth, daytime sleepiness or poor concentration, mood changes or irritability, as well as behavioral issues or cognitive decline. Those are all issues that sleep apnea can be occurring, and they should be evaluated. They should also have a cardiac evaluation if you have Down syndrome. An echocardiogram should be done in infancy, and it should be followed up as determined by your physician or a cardiologist. So now I want to talk a little bit about Fragile X syndrome. With this particular population, behavioral and mental health exam is very important. They should be monitoring for anxiety, ADHD, and autism-like behaviors, things such as limited eye contact, difficulty with peer interaction, delayed speech, repetitive language, hand flapping, rocking, lining up objects, over or under reactivity to sounds, textures, lights, distress with changes or transition, and intense focus on specific topics or objects. This is a sign that they may be struggling a little bit, so that should be being looked at. There's seizure risk, as well as a neurological evaluation that should be occurring if seizures are even suspected. They can run a test to see if it's actual seizure activity or not. So it's not that you have to feel like you have to determine that. Also with Fragile X syndrome, there can be some connective tissue issues. So they should be checking for joint hypermobility. Frequent sprains or dislocations can occur. They should be looking at the person to see if they have issues with flat feet, because this most certainly can affect their gait and posture. When somebody's gait is affected, they're at higher risk for falls, and falls, as we know, can lead to many different injuries, from broken bones to head injuries and worse. So we got to be careful of that. As far as cardiac, they have to look for mitral valve prolapse, because that can be common with those who have Fragile X syndrome. Looking for soft velvety skin, because that's common, as well as scoliosis. And frequent orthopedic concerns we see is pain, fatigue, and coordination difficulties. So all that should be looked for. Now we're going to touch upon Prader-Willi syndrome. For those with Prader-Willi syndrome, obesity can be an issue, and that can lead to metabolic syndrome. For those that are not familiar with metabolic syndrome, that's when you have 3 or more conditions, which would include high blood pressure, diabetes, as well as your waist circumference. They monitor all those things. If you have 3 or more going on, then they can give you a diagnosis of metabolic syndrome. So they should be monitoring your weight, your glucose, and your lipid levels, because also the cholesterol levels are taken into consideration to determine one of the 3. Sleep disorders, similar to Down syndrome, people with Prader-Willi syndrome do struggle with sleep apnea. And I just want to set a reminder here, sleep apnea is very common for those people with problems with obesity, and that's not uncommon for the Prader-Willi syndrome individuals, as well as those with Down syndrome. So that's why we'll see that more. Hypogonadism is an issue, so reduced or absent production of sex hormones, testosterone or estrogen. So an endocrine evaluation and hormone therapy considerations should be taken. Those with Rett syndrome, there should be some neurological monitoring, regular assessments for regression and seizures. They should be monitoring for scoliosis with annual spinal evaluations, and most certainly nutrition and growth. They should be monitoring for feeding difficulties and growth delays. Last but certainly not least, Williams syndrome. Though they should be having some cardiovascular screening, regular echocardiograms for supravalvular stenosis, which is common, and they should also be monitored for hypercalcemia. They should be monitoring the calcium levels in infancy. That tends to be when this can be a problem. Hearing and vision, routine checks due to increased risk of sensory impairments. So as I mentioned, I covered the more common syndromes, but please refer to syndrome-specific health checklists that you can find, and they also utilizing the NORD Rare Disease database that I mentioned earlier, that they will specifically tailor the types of screenings that should be done based on the person's condition. And again, that link will be provided later on in the presentation. Next slide, please. Diagnostic overshadowing. Some people are not familiar with this, but what it is it occurs when new symptoms are mistakenly attributed to a person's existing disability, rather than being investigated as potentially separate medical issues. So something that we typically see, especially with our members who may have some behavioral health type concerns, when they're seen by providers, lots of times they want to identify it and relate it to their intellectual disability, and it's overshadowed. They're not looking at the fact that they may have, in addition to, the intellectual disability, they also may have a diagnosis of bipolar or schizophrenia as well. So if they're not being diagnosed with those things, then they're not being treated for those things. And that's unfortunate for folks. So how do we avoid this? Definitely avoiding assumptions. They should not assume that all symptoms are related to the disability. Like I just gave the mental health example. That's absolutely something to be taken into consideration. So they should be doing a thorough evaluation. They should be investigating all new symptoms with appropriate medical assessments. And if the provider they're seeing is not skilled per se in that particular area, they should be referring the person out to somebody who is more well-versed and educated in a particular area, so they can give you guys the help that you need. What is the impact of diagnostic overshadowing? It's not uncommon that people are misdiagnosed or delayed diagnosis, which I mentioned can lead to worse health outcomes. And best practice, treat the individual holistically. Consider both disability-related and unrelated health conditions. Next slide, please. All right. And there should definitely be some accommodations during exams. Each person should be treated uniquely based on their situation. There should always be clear communication using simple language, visual aids, and repeat information is needed. If there are 10 different people going in to see a provider with 10 different conditions, the doctor should be looking at that person and treating them each individually and not just repeating the same information to each person over and over again. Familiar support person. They should allow a caregiver to trust an individual to be present. Be sure to encourage that the provider is speaking with the person, not just to the caregivers. This is something that actually I want to touch on a little bit more, and I'll use my daughter Veronica as an example. This past year, she was having some dental pain, and we brought her to the dentist's office. She's been going there for years. for her exams and, cleanings. We let her go back herself. That's not an issue. But she was experiencing pain, and there was concern, could she identify in a way that the dentist understood to make sure that she was properly diagnosed to then get the proper treatment. They absolutely refused for myself nor my husband to accommodate her into the room. So she did not get the care. We actually did find another dentist that could see her urgently, and we were grateful for that. But just want to explain that we say that this should happen, but unfortunately in the world, sometimes that's still not happening. And I'll use her as another example here when I want to talk about speaking to the person. It is not uncommon that we'll go to see a new provider who's not familiar with Veronica, and nothing bothers me more. She may not be able to communicate in a way that is understood by all, but she is a person and needs to be treated as such. So if she is seeing a provider, I want them to talk to Veronica. I want them to ask her the questions and let her respond. If she does not respond appropriately and we need to interject and provide some additional information so that way she gets the proper diagnosis and treatment, that's fine. But I'm really uncomfortable with, somebody where they're only talking to the caregiver or the family member and they're not including the person. I feel it's very important in order to remain person-centered and make sure that the overall visit is based upon that person. All right, I'll get off my soapbox on that, guys. Also, flexible scheduling, offering longer appointments or quieter times of day. So things that we sometimes see is doctors get that 15-minute window, and when you're on the 16th minute, they're walking out the door and only half of your concerns have been addressed. That is not acceptable. So most certainly, sometimes we have to be an advocate for ourselves and just voice our concerns. As far as quieter times of day, most certainly you can ask the office, when is it busier certain times than others? Do they have a private waiting room for somebody who's overly stimulated and it's going to make it difficult for the visit? As well as with scheduling, if somebody is a person that stays up till 2 or 3 o'clock in the morning, scheduling an 8 a.m. doctor's appointment is probably not in their best interest, and most likely they will miss that appointment. So make sure that you pick a time that would be appropriate. Sensory-friendly environments. So you want to reduce noise, bright lights, and other sensory triggers if that's something that bothers the person. So most certainly asking specific questions about the office setup is never something that you should feel uncomfortable doing. The secretary should be able to answer those questions when you call to schedule an appointment. Some offices will allow what's called a desensitization visit. So what that means is prior to the actual visit itself, which may be overstimulating to someone, they will allow them to go to the office for a tour and familiarize the person with the setting. So maybe go into that room, look and see what does it look like, just so they know, that's step one. And then the next time they go for their visit. So you can always ask the office if they provide that as well. Modified exam techniques, using alternative methods when possible to reduce discomfort. So one thing that sometimes people do require is they're unable to get on some of those exam tables because they're too high. So they're not getting that thorough assessment. So asking the office if they have an adjusted exam table is never something you should feel uncomfortable asking for either. And last but not least, respect the autonomy. Always explain the procedures and seek consent in a way the patient understands. And what I mean by that is if somebody is going to come at you with a needle, they should be talking to you about it. They should be telling you when they're going to poke you. If they're taking your blood pressure, they should be telling you that they're going to take your blood pressure, and all of those things, just so you know what's coming. Next slide, please. And Kate, any questions yet? Are we good so far?
We're good so far. Yeah, keep going. Thank you. Oh, actually, one just came in. That's so funny.
Wow, I'm a psychic and didn't even know.
You did. Yes, you are. So Wendy says, oh, sorry, my screen just went away. Does anyone have tips on finding a reputable autism-friendly provider like psychiatrists and therapists who accept a Medicaid managed care plan?
So, good question, Wendy. So what I would recommend is, I'm wondering first, I have to throw a question at you so I can answer this the best that I can. Have you discussed this with your care manager? Yes, not very helpful. Okay, so here's going to come the next part that was going to be later on in my presentation, but I'll just move it up because I think it's perfect to insert this part here. If your care manager is not aware of anything really, when it comes to health related and also behavioral health, then they should be reaching out to our clinical team. So as I mentioned, I'm the director of nursing, so I oversee nurses. So as we said, we deal with a lot of members, and actually I need to update my bio. I just found out we're actually serving over 51,000 members at this point between both agencies. So unfortunately, we're a small but mighty team. So we can't unfortunately deal directly with members or families because of the volume. However, we are a direct support to all care managers. We support all of them. So if they are not able to identify that, they should not be stopping there. They know that we're available. So what I would encourage you to do, Wendy, and it sounds more like it's some behavioral health concerns and not medical. So they can submit what's called a behavioral health clinical consultation. So what that means is where I'm the director of nursing for our nurses, Tiffany Patton is our director of behavioral health. She has clinical specialists on her team versus me having nurses. The clinical specialists are more well-versed with the behavioral health side of things. They will assist the care manager in identifying providers, and then that information would be shared by the care manager back to you.
Okay, that's helpful. I mean, I am remembering that I did ask, and I said we were more interested in like a private office setting rather than a big clinic. And the care manager said they only know like big Medicaid clinics. So that was as far as we went.
And that may, okay, thank you for that clarity. Yes. And so that's the thing. As I said, sometimes as far as the clinical team, we've been around. Actually, I started with LifePlan in 2019. So we've been here for a while. And then our VP, Jean Jacobson, she's the VP of our clinical team. So we've definitely been around for a while. But I can say regardless, sometimes the care managers don't know when it's necessarily appropriate or not appropriate to reach out for the consultation.
Okay.
But that's why I wanted to share, on this meeting so you guys know what to ask for, and then they can follow that process because they'll reach out.
Yeah, that's really helpful because what you're saying, like about the the physical doctor, sending somebody with autism to a big clinic in the middle of New York City is not going to do it. At least my kid is not going to do that. So, yeah.
I definitely understand. And so we also have what's called DSNY, and I'm sorry, I'm forgetting what the acronym's for. It's actually a brand new platform that's come out. If you put it in the Google chat, you should be able to find it. And what that is there was a grant, and it was a partnership between the Department of Health, and I'm lucky to say I was able to be on kind of the later half of it, but also in correlation with ACA LifePlan and another CCO. And what that is, it's a database that's been created where surveys were sent out to particular provider offices. And we asked about, handicapped accessibility and different things. Initially, there was a lot of questions. I think there was 47 different areas they wanted the providers to respond to. So because of the amount of questions, we didn't feel like we were getting as many responses. So they did, remove some of those questions. But that also might be a point for you to go to because you can look for providers on there as well.
Great. Okay, awesome. Thank you.
And it's called DSNY.
Yes, I am Googling it. Thank you. Great.
Okay. Disability Services of New York. It's coming to me now. That's what it stands for, but it is a fairly new platform.
Okay, perfect. Thank you.
All right. And if you're still struggling after that, though, or you don't feel like your care manager was submitting for a clinical consultation for whatever reason, please always reach out, and I'll have Kate provide more details with this. Kate, how would they reach out to the liaison? Because you guys can most certainly facilitate that as well.
Yep, I will put our email address right in the chat, and if you want to reach out, we will absolutely help you with that. And I also put the Disability Services New York website in there too, so you can just click on that direct link.
Perfect. Thank you so much.
You're welcome, Wendy. Good luck. It's not always easy. You're welcome. All right. And next slide. Yep, functional assessments. That's where we need to be. Okay. A functional assessment evaluates how the person performs daily activities and identifies supports needed to enhance their independence, safety, and quality of life. For individuals with IDD, it focuses on communication, mobility, self-care, social interaction, behavioral regulation, and cognitive functioning. I want to talk about some of the key components of a functional assessment. So there needs to be a person-centered approach where they're focusing on the individual's strengths, preferences, and goals. There needs to be environmental context. What we mean by that is they need to consider, where's the person, where's their home, where's their school, do they work, are they in a community setting? All those things need to be taken into consideration, as well as they need to look at their support needs. They need to identify areas where assistance or accommodations are needed. Behavioral analysis should be taken into consideration to understand triggers and functions of behaviors, as well as health and wellness, including their physical and mental health considerations. Next slide, please. All right, so now I'm going to hit upon a hot topic. Why does my care manager ask me for a copy of my physical? I know some people are very uncomfortable with this, so I thought this would be a good opportunity for me to talk about why. The number one reason, it is required by OPWDD. This is looked upon when they come through and audit us, and if we do not have one on file within the past 12 to 13 months for each and every member, we will get what's called a deficiency. They will give us a hard time about it. So that ultimately is the number one reason why we do that. But on the other side of things, it's really not a bad thing, because what is your care manager? What are they doing with that information, right? How does it help you to know that they have a copy of this? So your care manager is able to utilize this information with your health needs. They can assist with arranging appointments. They can advocate for you at appointments. They can assist with arranging transportation to those appointments. They can assist with medication delivery options, help to explain the diagnosis that you have. And again, if they don't understand it themselves, they know they can reach out to the clinical team to help support them. And then in turn, that information will be relayed to you guys. They can provide information regarding support groups and other resources. They can utilize, again, the CCO clinical team, the nurses and clinical specialists, to help with medical and or behavioral health concerns as they come up. They can assist with discharges from facilities, hospitals, and nursing homes. They need that information that's on that physical. So if your care manager has it at their fingertips, they can much better be in a position to help you with that discharge planning. And also it helps them to know in order to be able to assist with equipment needs. Sometimes those items require justifications and different things. So having that information is very important. Some people say they don't want to provide it and that they do everything. Let's face it, I do everything for my daughter, but I have to admit, I think it's great that, I know that our care manager, Heather, has our back. So if we need anything, she's there. If she needs to contact a doctor's office to ask questions, this information is very helpful. So please know that it's not just us trying to be nosy. There is a couple of reasons why it is asked for. So any help with that is greatly appreciated. You most certainly don't even have to wait until your care manager asks for the physical. If you go and attend the physical yourself, or you're a caregiver or family member, please know how helpful it is just to get a copy of that and hand it over to your care manager the next time you see them, or scanning it and emailing it. It's greatly appreciated. Next slide, please. All right. Another thing that I thought might be helpful, I think this is something that's frequently, not known to people, is navigating health coverage after 26. So most people think that the only option they have once their loved ones turns 20, it goes beyond 26, is to have Medicaid. And that is absolutely not true. This is actually a benefit to our loved ones, to keep them on your commercial plan if you're able to. I understand that for some people, it's an additional charge to pay for that family plan versus maybe an independent or, two persons, so that each person needs to do what's best for them. But it's like, so for I'll give you an example for our situation. I have to pay for a family plan for another 6 years. We have in addition to Veronica, who's 25, we have a 23-year-old son and a 20-year-old daughter. So I'm paying for that family plan anyways. It costs me nothing extra to keep Veronica on there. So how that works is commercial would be the primary insurance. And then any copays or deductibles that you have on your plan, Medicaid would then pay for. So still at the end of the day, you're not paying anything out of pocket. In addition to that, it opens you up new opportunities. Sometimes we're stuck looking for those Medicaid providers. And let's face it, guys, either we can't find them because they don't take the insurance because the reimbursement rate is low, or we're traveling long distances, needing to take time from work. So most certainly, as I said, this is something individualized for what you have to do what's best for you. But I just wanted to add that to today's presentation because I still feel like there's a lot of people that don't know this is an option. Some caveats to it are that you absolutely have to make contact to your commercial insurance company prior to the person turning 26. So for example, we have to do that prior to November, or Veronica would not be able to remain on my insurance. And the other piece that I wanted to mention is sometimes people ask, well, what if they're Medicare eligible as well? How does that work? So as far as the order of things, Medicaid is always the payer of last resort. Commercial would always come first. So, and even in our situation, Veronica does have commercial insurance, Medicare, and Medicaid. So what would happen is the commercial insurance would be billed first. Anything not covered goes to Medicare. And then if there still is a balance after that, it goes on to Medicaid. So she's a well-insured young lady, to say the least. But just wanted to share that information with you guys so you knew that that was an opportunity. Next slide, please. All right, and here's where I mentioned I was going to provide some resources. So as Kate said, she's going to provide the video and the slides as well, Kate?
Yep. Okay. So I'm going to send a follow-up email in the next week, and it's going to have a link to the video once it's posted. The marketing department has to make it all lovely and fancy. And
I appreciate their...
We basically cut me out. No, I'm kidding. And then I'll also attach the presentation